Hello, everybody. We'll go ahead and get started. Welcome to our next session of Lunch with a Boxer. Today, we are going to have Perla from our Student Health Center come here and present to us about what kind of resources are available for our students on campus. And if it's your first time joining us, welcome. We will have the presentation, and throughout the presentation, any questions you have, go ahead and fill it into the messages here, and you can and I'll make sure to read the questions aloud at the end of the presentation. And if you're feeling a little shy, you can go ahead and direct message me in a private message, and I'll make sure to read the question aloud anonymously. This session is being recorded, and we will be posting this on our YouTube channel. So any information and links that we put into the chat here, we'll make sure to add it into the YouTube description box as well, so everyone will have access. So I'm going to go ahead and we also have interpretation services. I'm going to start, and I think that should work there. And I'm going to go ahead and hand this off to Perla. Hi, Perla. How are you today?
Hi, Gina. I'm good. Thank you for having me. And thanks everyone for attending our Lunch with the Boxer today. So I'm just going to talk a little bit about the health center and the resources that we have available for students and employees. And I would like to start by sharing my screen here. Okay, so at the Student and Employee Health Center, we provide accessible quality healthcare for employees and students, and we focus in promoting physical and emotional wellness. Who we are a team of dedicated professionals. We have experience working in the community. I currently have one MD, Dr. Melanie Doak. I have 3 medical assistants. We have 2 front office coordinators. We also have 2 physician assistants. Kaylee Barfield is with us full-time, and then we have Judy Flynn, who is been seasoned physician assistant, and she helps with coverage. So when you schedule an appointment, you can be seen by any of the 3 providers. The services that we offer to our students are a little bit more wider than what we offer to our employees. So the goal for the Student Health Center is to act as your primary care provider when you are in school. We are located conveniently on campus here in Forest Grove, and then we have another office in Hillsborough, and I'll give you a little bit more details regarding the clinics in a little bit. But you can be seen for evaluation and treatment of chronic conditions. We treat infections, UTI, upper respiratory infections, skin conditions. We do sports physicals. We also have an in-house lab. So if we need to have your lab work done that is required by the school, you can come here. We do work by appointment based. We do have same-day appointments available. And we always try to make room. If you're having an emergency, don't think that we won't be able to see you because you don't have an appointment. Please call us, and we always do our best to work you in. We also do immunizations, and something that we're promoting right now is it's our skin treatments. We do biopsies, we raise warts, and that's just some of the services that we are providing. But again, we function as a primary care doctor's office. So if there's anything that you need and you don't see it listed, just give us a call and we will tell you if we could see you or not for that condition. So eligibility, as long as you are an active student at the university taking 1 or more credit classes, you are eligible to be seen here at the health center. And we participate with most insurance plans. I have a list here. And again, if you don't see your insurance plan, that doesn't mean that we can't see you, but more likely it would be an out of network office visit. by out of network, meaning that your copays would be higher than it would be by going to see an in-network provider. If you do have the student Aetna insurance, the office visits at the health center are well, they're not free, but you don't pay for them. We build insurance and then you don't have out-of-pocket expenses, and your deductible does not apply. So your visit is covered at 100%. Our location, so we have our Forest Grove location here on campus on College Way. And then our Hillsborough location is off campus, 2 blocks from the main Hillsborough campus. It's at 730 Southeast Oak Street, right on the corner of 7th and Oak. And that's all the information I have. Do you have any questions?
Yes, thank you. I actually had several questions kind of come in beforehand through our Google form. I know some families weren't able to make it, so they let us know. So I'm going to kind of go through the list that we got. And I know you kind of covered it already in your presentation, but I think it'll help to just kind of reiterate some of the answers here. So can the health center write prescriptions or fill any prescription medication?
Yes, you need to be established patient, but we have the ability to provide prescriptions or send them to your pharmacy.
Okay. And I know you mentioned that we do have several different companies that we work with. So if the student health center does not accept the insurance that the student has, then you said the copay is just going to be a little higher, but you can still meet with the student. Is that correct?
Yeah, so how it works is we are contracted with insurance companies. There are some insurance companies that we have not been successful contracting with, and that's because either they have already the amount of providers in their panel and they're not accepting new providers, or because we haven't been able to establish an agreement. So if you're seen by an out-of-network provider, let's say your deductible is $300 for in-network, it typically is a lot higher for out-of-network. So yes, your expenses are going to be a little higher, but
Okay.
it's very minimal. The insurance is that not contracted with.
Perfect. And another question that we get often actually is, does the health center share records with the primary care physician that the student typically works with?
Only if you want us to. If you want us to share your records, you need to give us written consent. We will not share students' information with any other providers or with the university. Your professors, your coaches will know that you're being seen here as a patient, as we do follow FERPA and HIPAA laws.
Perfect. And for the students, what are some examples of things that a student should come to the health center for? I know there are some urgent care things that typically the student shouldn't go to for you guys. Can you go into a little bit more detail
If
about
you
that?
feel like you're having a heart attack, don't come to the health center. If you had a seizure, first time having a seizure, don't come to the health center. We don't have the equipment to see you. If you feel like you broke something, we don't have an x-ray machine, so that would be an urgent care. But as always, if you are not sure, give us a call and we will guide you.
Okay. And does the health center put on any type of programming on campus for students to raise awareness? And if so, can you give any types of examples?
Well, so right now we're working on improving our website with information for students. I have Dr. Doug is actually working on a project on healthy eating habits. We have participated with the library and done some classes there for students. We have also worked together with some programs and doing training. I'm working with student affairs so that we can find topics that would be of interest to the students that will not compromise HIPAA, so that we can just come and talk to the students about, I don't know, birth control, for example. So yeah, we are actively trying to be more out there for students to be aware that they can be seen. And we're more than just a health center, more than just, oh, I'm not feeling well.
Mhm.
We're trying to work in improving other aspects of wellness.
Perfect. I only laugh when you said healthy eating habits, as I've definitely seen some students with a little bit too much bacon on their breakfast plate sometimes. So, what do we do if it's after hours or on weekends? Where should the students go if they need some services?
We unfortunately don't have weekend or after hours, so we best the best places would be urgent care. We have a list of urgent cares in the area in our website. The one that we work the most with is OHSU, which is right over here in town. I know that they opened a new urgent care in town also, so we're working on adding their information on the website.
Perfect, thank you. And this question also came in is, my student will need to have regular allergy shots. Our doctor here said that the serum would be prepared and would be sent to the health office for the injections. Can you explain how things like that would kind of work?
Unfortunately, we're not able to store medication that is not purchased by the health center and by our vendors. We do have to have a pharmacy license for that, which we don't.
Mhm.
So we can help with that. We don't have the crash cart that would be needed. There are several steps to that, and we are not prepared to do that, unfortunately.
Okay, and then what types of forms are needed for students to fill out before getting to campus? And if they do get to campus, are there any documentation that they need to bring with them?
We do ask for a picture ID and a copy of the insurance card when you come in. If you have a condition that you've been followed up, or if you're in treatment for a current condition and you want us to be your prescribers, we do want outside records.
Perfect. And again, one more time, if how can families, where is there a website that they can go to check which insurance or if their insurance is covered?
Yeah, we just have the Student Health Center insurance, or the Student Health Center website here through Pacific. I can look it up real quick and post it in the chat.
Yeah, and again, I'll go ahead and add the link into the YouTube description box. Everybody has the link that they can click onto, so we'll make sure that everyone gets that information.
And so I'm posting the link into the chat, and then if you just go under accepted insurances, you should see it there.
Perfect.
Here is the link.
All right, thank you. And I'll go ahead and make sure that is set there. And will the health center notify the parents if the student needed care?
We don't. So again, because of HIPAA, we don't. We can't tell your parents you are a student here or you're a patient here with us unless you give us written consent.
Perfect. And then can you talk a little bit about the mental health services? I do know we have the counseling center who will be presenting, but they're not going to be presenting for several more weeks. So is it possible that you can kind of go over some of the mental health services that we are able to offer? And
Yeah, so with the counseling center, as a student, you get 10 free sessions a year. And you meet with your counselor. It's appointment based on, also they do have walking hours from 12 to 1 every day. So if you're having a mental health emergency, you can just walk over to the counseling center. And we are very conveniently next to each other here in Forest Grove and Hillsborough. We share the same office space. And if they feel you need to be put on medication, they can refer you to us so that we can prescribe. They also do referrals outside the community to psychiatrists if needed. I know that their counselors are psychologists. So if they feel you need to be referred to another type of specialist, they will do that for you. And we often collaborate in the fact that if they're seeing a student for counseling, they might come to us for prescribing the medication.
would this be an option for students who need kind of regular appointments with therapists, or is this more for kind of the students who, I know, for example, a lot of our students use the services right around testing time because of test anxiety as well too. Is this an alternative for students who need some of the kind of the regular check-ins?
Yeah, that I believe there's an alternative, but also if you're feeling really stressed, you can't get into the counseling center. You can come see us. We have one of our physician assistants who did her externship in behavioral health, Kaylee Bartle. So she is been great at working with students too.
So, and the question that came in as well is, do students need to have all their COVID vaccines this year, like the booster shots? What are the requirements for that?
So the university changed their policy on that, and I believe now it just changed, so I'm still not too familiar. So we do require the initial series, and then depending on the program, so no, the COVID-19 boosters are no longer required, but depending on the program, your program, if you are doing clinical rotations, they might need you to be required. If you're working with children, they might need you to be vaccinated. So we would like you to refer to your program. But also I will post the COVID-19 page. The link.
Thank you. And I'll go ahead and make sure that link is also going to be available for all of our families here as well. And I don't see, excuse me, too many additional questions that are coming in. And again, the Student Health Center, their website has a lot of information, including their contacts and hours, and information about what types of insurance is accepted. Location-wise, the Student Health Center and the Counseling Center are in one building, so it's very, very convenient. And even more convenient, they are right next door to us here at Night Hall in the admissions office. So if you've come for a campus visit, just walk 3-4 steps down the sidewalk and you are right in front of the Student Health Center and the Counseling Center. I don't see any other questions that are coming in. Were there any other things that you think would be important for our families and students to be aware of for when they get to campus this year?
Yes, one of the questions that I'm often pretty frequently asked is, do we have a pharmacy on site? No, we do not have a pharmacy on site. There is Safeway here in Forest Grove or Walgreens in Cornelius, where we can either send your prescription electronically, or we can give you a printed prescription you can take to your pharmacy. And then we also do not have physical therapy services here on site. We work together with the Pacific University Interprofessional Clinic. They do have physical therapy services there, but we do not have them here on campus.
Awesome. And I got one more question here. Does the Student Health Center give sick notes or like doctor's notes if they're missing classes for any sicknesses?
Yes, but you do need to be seen. You can't just call in and tell us, hey, I need a doctor's note. We actually have to see you and evaluate you, and then you will get your doctor's note.
Awesome. And what happens if the student does contract COVID while they are on campus? What types of resources? How will the student, I guess, kind of be in, I can't use my words today, I apologize, in quarantine, if that is something that we still need to do?
Yeah, so we're running low on the COVID tests that we've had. So when we are out of those COVID tests, then they won't be free anymore. So we will, if you suspect that you might have COVID, we will have you schedule an appointment and do the COVID test. If the test is positive, then we'll have you go to your room and quarantine. So right now it's 5 days. And then after the 5 days, you can go back to class wearing a mask. And during those 5 days, we have the resources here on campus so that either an RA would bring you food to your dorm, or you can just go to the pickup window at the UC and pick up your food there.
What happens with like our incoming freshman students who are typically in a standard double and they might have a roommate where they can't really be away from because they just share that one room? How would that work?
They do make accommodations to send you to a temporary room, or your roommate can go into another dorm.
Awesome. Are there any things that you recommend that students bring, like a thermometer with them, so they have on hand? What are some kind of important things, or any advice things that you can recommend that students have with them?
Yeah, it's always helpful if you bring a thermometer to check your temperature. Digital works best. And also some Tylenol, some allergy medications, Band-Aids, ice packs. Those are very helpful. Um, Maybe some cough syrup, in case of a cold. Just make sure you're checking on the expiration date.
Yes.
But we do recommend that you at least bring a thermometer, some Tylenol and ibuprofen, in case of pain.
Awesome. And just in case, maybe a possible COVID test if you have some at home, just so that the student has access to it in case we do run out on campus. But I don't have any other questions coming in. And that was very informative, Perla. We really appreciate you always hopping in and helping us kind of share with our families about some of the services. And you've always been a great support for us here. And again, for everybody who is watching the video recording, this will be posted, as well as the links that have been provided for us. And if they need to get in contact with somebody with some additional questions, is there a preferred contact email or phone number that you can share with us as well?
Yeah, so it's always best to call, because that way we can answer your questions right away rather than going back and forth with emails. But if email is the only thing that works for you because you're not filling out two, then you can email us at healthcenter@contact.pacificview.edu. Or you can call us at 503-352-2269. Our messages that you leave will be confidential. We do ask that you leave us your name, date of birth, and a good callback number.
Awesome. Thank you so much. So again, I'll make sure to add the contact information on there. So I know there was that kind of more specific question on how to get some of the medication to the student. So I think it might be best to go ahead and contact the health center directly to get more of that individualized attention and information that is needed. Thank you so much, Perla. We appreciate you hopping in during your lunch hour, and to our families joining us, we appreciate you coming in as well. Next week is actually our spring break, so we're going to take a quick break. We won't have a lunch with a boxer session next week, but we are going to follow up on the first week of April with Kim Garrett. She is the director of Office of Accommodations and Accessibility, and she'll be able to talk a little bit about the resources in the classroom to help support students, for those who might need a little help, or have some of those learning disabilities who might need a little bit of support when they get to campus as well. So once again, next week, we are going to take a quick break for spring break, and we'll be back the following week with Kim Garrett at the Office of Accommodations and Accessibilities. Thank you, everybody, for hopping into the session today. We appreciate it. Have a great rest of the day, and we'll see you in a couple weeks.